upon that, there's a little controversy in the meso world about the EPPs versus the pleurectomies versus, whatever.
Yes. So every patient is different. Every disease is different. To say that one treatment fits all is wrong. I mean, we do have passionate people on both sides of the screen, right? We have people passionate about EPPs, you have people passionate about pleurectomies. If you really select your patient appropriate to the disease stage with the correct treatment, it really isn't different in survival. Okay? Now, the difference comes from 2 points. One is staging. Again, the early diagnosed staging of the disease is paramount to the survival of the patients. That's number one. Number two, you can go and have an EPP and don't do well, or do a pleurectomy and don't do well. The issue there was the wrong treatment for the wrong patient. You have to tailor that. A few patients will benefit from a left extrapulmonectomy, early stage, young patients, female. No question about it, with good pulmonary function. Someone who's elderly and it's got poor pulmonary function, to take the whole lung out, they might not do well. So you have to tailor your surgery. Having said that, I, for one, have been a great advocate of saying you really have to select the patients for the right operation. The results, survival, very little difference. What is different is sometimes you have early recurrence or more recurrence in the pleurectomy side. But now we know that we can go after those recurrences as well. So I don't know if I answered your questions, but we have as many patients in one arm versus the other with long survival and doing extremely well.
Yeah, which is a good message to get out there.
Right.
There is patients surviving, but more importantly, they're doing well.
Correct.
They're living
Right.
a good life, good quality of life.
Right.
And are you seeing younger patients, Dr. De Silva?
Not yet. They haven't come my way yet. I'm getting the pipe feeders and the plumbers, and when I came here, I thought pipe feeders. I thought they were extinct. I guess they are, except in Chicago.
Oh.
But I hope, in all honesty, I hope I don't see young patients.
Yeah.
We're plenty busy, and we're passionate about mesothelioma care. But mesothelioma, as we all know, it's a dreadful disease. But we have hope. We have ways to treat those patients.
All right. Yes. So that would you think that would be, that's, I think, the important message that you want to get out here, that, you're in Chicago, you're, up and running, and there is hope.
Correct. There is hope. There is very intelligent, capable, educated physicians involved in the care of the patients. We understand much more about the disease now than we did 10 years ago. We understand much more about which treatment is better for every different patient than we knew 10 years ago. I think the future for mesothelioma patients is really bright. I do not subscribe to a nihilistic approach. I don't believe in it. I don't believe even someone a fishing rod is the right treatment, although it might be for a few cases. But I don't believe in that. I don't subscribe to that. I'm one of those half full glass up guys. So I usually tell the patient, let's go. If you're up for it. I saw 85-year-old lady. She needs surgery. She says, am I too old for that, Sonny? I said, no, you're not. If you call me son, you're not. You're on the schedule.
Again, positive attitude always helps.
Correct.
Thank you.
Well,
Thank you.
Yeah, very good.
Any other questions, Katie?
I think that's all the questions that I had. So if there's any questions from you or Ellie, feel free to ask them, but if there are no questions, we can conclude this.
Dr. De Silva, do you have a website?
I do. What I will do for you is I will send it to you.
Perfect.
Okay.
Great.
But it's a lot. It's Loyola dot something else. I have to go back and get it, and I'll send it to you guys.
Just send it to us.
There's a website, and we're trying to create a mesothelioma website. I'm in the Loyola website, which has 2 of my interviews, including an interview about mesothelioma. And that'll be www.loyolamedicine, one word, .org, and then you have to search Da Silva, and that comes right up. So what I've been working with the hospital now is to create my own website within the hospital website for mesothelioma, but somehow that has become a challenge for me, believe it or not, within my own institution, but I'm used to that already.